and welcome to another edition of Veterans Forum. My name is Rebecca Jennings, a Veterans Agent for the town of Plainville in North Attleboro. Today we have a guest that are on. They're going to talk to us about hospice. Welcome, ladies, Kelly and Lisa.
Thanks, Rebecca.
And you guys are from Beacon Hospice.
Right.
So today we're going to kind of dive into all different types of topics. As what is hospice, first of all? What is your mission statement? But before we get into that, can you tell us a little bit about yourself and how did you get into working in this type of field?
Okay, so I'm Kelly Woods. I'm actually from North Attleboro. I've worked for our parent company, Emeticis, for a little over 8 years and been on the hospice side for the last 4.5. And absolutely love that we can help patients have equality and dignity at end of life.
And I'm Lisa Kaiser. I'm a liaison out of the Fall River Care Center. And my role basically is to help facilities, which could be a nursing home, hospital, doctor office, connect with their patients and families to come on to service. I've been with Beacon for 2 years, and how I ended up here, I had been in medical sales for quite a few years, and I just wanted something that really helps people. And hospice is something that definitely is a great service that we provide. So it's been great being here for 2 years.
That's awesome. Now, your organization is part of a parent company. Can you give us a little insight on your mission and the parent company that you're
Absolutely.
on?
Yeah, so Emeticis is our parent company. They began over 30 years ago in Baton Rouge, Louisiana. And we do home health, like skilled services, hospice, and private duty. So we have the full continuum of care in Massachusetts. And our patient mission statement is remember why we're here. We always want to make sure that we honor what the patient's goals and wishes are, whether it to be home or in a facility. Where can we help them with their acute care after they either have a hospital stay or an end-of-life illness kind of strikes them.
Oh, okay. Now that you told us the mission statement of hospice, Beacon Hospice, what exactly is hospice? There's a lot of misconceptions about hospice. Take, for example, you go into hospice, you're automatically going to pass away, but that's a huge misconception.
Absolutely, yes. And that's our biggest goal with the organization is to educate and try to get folks to understand what hospice is so they can receive the benefit for the full time that it would be available to them. So if you have an illness that's considered a terminal illness and you need some extra services either at home or in a facility or an ALF, what would happen is we'd start to have the conversation about what benefits we could provide. Your PCP, who's your primary care physician, would have to, or your oncologist or your specialty doctor would have to say that the illness that you have would possibly give you 6 months or less. Now, a lot of times that goes beyond, a lot of times it goes below.
Sometimes they can go up to 2 years,
Right.
sometimes 3 years on
Right.
hospice.
Absolutely right. Yeah, and it's definitely a myth that we see every day. Folks are very scared to come on. And what we find is after we have that privilege to help our patients, that 89 to 90% of them say, I wish I had it sooner. Because they realize that we're not changing the prognosis of their illness, we're there to support them. And often, it's not just for the patient, it's for the family too. So if you have a son or daughter that's taking care of a mom or dad, they can actually be the son or daughter while our nurses come in. So it's a full interdisciplinary team. Nurses, social workers, chaplains, we have volunteers, we have home health aides, and you can have as much of that team as you want. The least amount you have to accept is a nurse every 14 days. And so sometimes patients want it all, sometimes patients just want a little bit at first, but as we see the disease progression, will increase our frequencies in the home if needed and if that's what the family wants. But every care plan is different for the patients and the families, and we really center our care plan around what the goals are for that patient and family. Do they want to stay home? Do they not want to go to the hospital anymore? What's that one last thing that they want to achieve? Do they want to go on a whale watch or, go to Disney World? These are the types of patients that if they come on soon enough, we can help fulfill their end-of-life goals and wishes with their loved ones.
And you sat down with the family. That's like the first initial intake is you sit down with the family and really talk to them about what their wishes are.
Absolutely. Yeah, we'll maybe meet a family sometimes 10 times before they say, okay, we're ready. And the great thing about our organization is if they're not quite ready for hospice, maybe they qualify for home care services. So they have something to keep them home if that's their goal. If they qualified for that skilled service, and then we can bridge them over to hospice when it's appropriate. But yeah, we'll sit down, we'll do informationals. You don't need a doctor's order to do that. We can come and do informationals anytime just to give you information, whether you're home, in a hospital, in a nursing home, assisted living, wherever you are, we meet you where you are.
Okay.
And we're truly 24/7. So when you do come on service and you're working with our teams and you have something and you see something at night, your loved one's not feeling great, we're truly 24/7 where you really do have that availability to reach out to us.
Now, this may be kind of a generic question, but what type of things do you see in the hospice? Like the type of illnesses and things like that do you see that patients are coming to you for hospice?
Yeah, a lot of people would think cancer would be our number one diagnosis,
Yeah.
but we do see a lot of cancer. We do see a lot of COPD. We see a lot of cardiac issues, and we see a lot of dementia with our agency because we do have a specialized end-stage dementia program, which if anyone's familiar with, we call it deep harbors. So we have special non-pharmacological interventions that we put into place for our end-stage dementia programs. But really any diagnosis that a physician
Anyone.
deems could say the prognosis of this disease could perhaps take the patient to end of life at 6 months, we can definitely support them.
Oh, okay. Okay. So that's a pretty common question. I think a lot of people, it's back to what we were saying earlier, it's a misconception.
It is.
A hospice, and they automatically assume,
Yep.
certain illnesses, but it's a genre of different illnesses that you see and stuff.
Absolutely.
Now you have different resources that are available through Beacon Hospice. Now you have a whole personal care. Can you get into that a little bit?
Yeah, so what each of our disciplines may do in the home, is that what you
Yes.
are meaning? Okay, so our nurse will generally come out first, and they will determine really what the frequency of the care plan would be. So it can be once a week, it can be twice a week, 3 times a week. It just totally depends on what is going on with that patient. And then as far as personal care, they can have home health aides in the home. So again, based
What
on
exactly do they do when they're in the home?
So it just totally depends on what that family's looking for. So they might need help with their ADLs, with activities of daily living, bathing, eating. They might just want a companion. So our aides could be bedside, just reading to them or playing music with them if they don't have a lot of visitors during the day. Our chaplains will go out too, and you don't necessarily have to have a denomination. It's just a spiritual support that you can have. We also have a social worker, so the social workers can help with a lot of things. They might help with, if you're a veteran, what benefits are out there. If you need additional help in addition to us, like Meals on Wheels, or some additional help through, Bristol Elders or whoever is your
The social workers will help coordinate that?
Yes, yep, they'll help do all that, Medicaid applications, they can help. I know a lot of people may not want to talk about it, but funeral planning, so that the family members, that burden is off of them, and we can start to set some of those things up for them. And then we also have volunteers, and we really try to specialize in matching the volunteer to the patient, specifically to maybe what they enjoyed. So if they're a veteran, maybe we match veteran to veteran volunteer. Some of our volunteers like to sit bedside when a patient's passing, so we have volunteers that will do that. So it just totally depends on, where that person is in their hospice, stay, and what's appropriate for them to accept whatever disciplines they'd like from us.
Now, if somebody wanted to become a volunteer, how would they go about doing that? Just out of curiosity.
Yeah, so they would we have a volunteer coordinator in our office, and she heads up, the background checks and everything that they need to do with us to get started. And then there's, some paperwork that they'd have to fill out. But we represent the Fall River office today, so we can share that number at the end if anyone's interested. And we would love to have volunteers.
We're always looking for volunteers in the community, especially someone that might have just retired and is looking just for a couple hours a week to get out and help someone in the community.
Yes.
So we go to a lot of different events, like touch a truck events and different things in the community, and we'll pass out brochures trying to see if there's anyone that would like to volunteer and help us out, because it is a great thing to give back. And there's so many people that might be in the situation where, like I said, they've just retired and they miss having that connection or just being able to, sit with someone. So if there is anyone that would like to volunteer, we'd definitely love to have them. So that'd be
And
great.
they don't necessarily have to be with a patient. Some volunteers might want to knit a blanket or pillows. We have some that make pillows for us, though, that we can bring to our patients. Or, like I said, they like knitting, so we have Afghans for our patients. We have one volunteer that makes our red, white, and blue Afghans for our veterans. So when we do,
Oh, that's awesome.
we'll talk about a little bit more our pinning ceremonies. We generally will bring them that Afghan. It's beautiful. It's one of the best things that we do. So it doesn't necessarily have to be, with the patient, but any time or anything that they have a specialty with. We have one in our Metro West office that does videography. So she videotapes our patients and lets them make a video for their loved ones, and so that they can hear their voice. And so someone has pets, we have one lady in Leominster that has a horse, and she brings the pony into the facilities
Oh,
to
wow.
visit. So it's all different types of volunteer, and those are the types of things that warm our heart, because that's why we're here every day. If we can make a difference. We love pet therapy. If there's anyone that does that or plays music and they want to come out and talk to us, we would love Reiki, anything like that. Any specialty that they'd like to share, we're more than welcome to.
I'm sure we have a lot of generous people in the community that would be willing to step up and to
be great.
volunteer and stuff like that. So, because we often get calls from the Veterans Department about volunteering, and that's one of the things that we often do is we give out phone numbers, such as yourself, to refer them over to, because they specifically want to volunteer to help a veteran.
That's fantastic.
So, and to coordinate and to partner with with folks such as yourself would be great. So,
Good.
now there are some things that you do specifically for veterans. Tell us a little bit about what do you do for our veterans in our community?
Yeah, so as an organization, we've taken a huge initiative to be very active with the National Palliative and Hospice Care Organization's program called We Honor Veterans. So what that means is they started a program where it's 4 levels. Each level is an amount of education that we provide to all of our staff so that we know how to work with veterans specifically at end of life based on maybe the war that they served and some feelings they may have. So we go through these levels so we have 9 care centers in Massachusetts.
Okay.
8 of them are the highest level, level 4. The 9th one is level 2. We just acquired them a year and a half ago, so they're just kind of catching up to our philosophy. So basically what that means is our staff is very dedicated to truly understanding the veterans at end of life and what they may experience and what they may or may not want to talk about. So, and the other thing that we can do with that is what we call pinning ceremonies, and this is probably one of our favorite things to do. We do them a lot during Flag Day, Memorial Day, Veterans Day, obviously, but we'll also do individual bedside pinning. So when we bring on a patient, part of the admission packet is to understand if they were a veteran, if they want to be honored. Some may or may not want to have that recognition at the time, but if they do, we'll offer a pinning ceremony. So what that means is we'll bring in as many people as we can from our organization to do a pinning. So we pin our veteran. Some people like it to be one-on-one with family. Some people like to have a huge, we had one family that brought everybody in, had a professional photographer, and had a great memory now to be able to have done that. And we'll bring them a certificate honoring the branch that they served. And, we may say a poem, we may sing, the Star Spangled Banner, or whatever that may be that they'd like to have. But we're able to do that because of our active participation with the We Honor Veterans program. We actually are one of 7 hospices in the country to be at level 5 in our Hyannis office.
Wow.
So that's a huge accomplishment. So with that, they're doing what we call vet-to-vet cafes. So in our local nursing homes, they'll go out and they bring all the veterans. It's usually once a month, and they'll bring them all, for coffee in the activities room or wherever, and they'll let them all kind of chat, and we'll lead those conversations. And sometimes we'll be able to bring in some of our veteran volunteers or folks from the VFO. So whatever that may look look like, but we've probably done about 15 of those in Hyannis, and I know the Fall River office is starting them as well. So the vets in the facilities love it because
So they just have coffee and sit and chat with each other and,
yeah,
you know,
yep.
connect with each other.
Absolutely, and it's their time to talk about whatever they'd like to talk about, and it's their special time. So we just have a huge passion for our veterans, and you know, we're honored to be able to care for them.
Yeah. And I actually work directly with the Brockton VA, which I know
That
we
was
had-
the other thing I was
Yeah.
getting ready to ask is how your affiliation with the Brockton VA.
Yep, so Beacon has one with the Brockton VA. We also have one with the Providence VA. So I work directly with the Brockton VA in helping them, if they are identifying a patient or family member that they think could use hospice and could use the help, they'll have me do an informational with the patient and the family so they are aware of all that hospice is about and what we can help them with once they try to get home. So it's a great partnership that we have. And then once the veteran is on service with us, as Kelly mentioned, our social worker works really hard to make sure that that veteran knows of all the benefits that are available. Because I know when working with the Brockton VA, if we put in a home health aide 5 days a week for morning care, I know that when I contact the Brockton VA, they will actually match what we do, and through the veteran benefits, they will then get an aide 5 days for the afternoon time. So there's a lot of different benefits that are available that not everyone is aware of. So there's a lot of other things that we help make sure that the veterans can get if they're eligible for them. So that's the good thing about having us in the home, because sometimes the patient and the families, it's overwhelming and they're just not sure, and we want to make sure that they're getting the most benefits that are out there, especially for the veterans that might not have a lot of family and really could use all the help that we could help get for them. So I really enjoy working with the Brockton VA and the veterans because it's a special group, and like I said, a lot of times they need a lot of help. So we're there to make sure that they can get everything that we can help them with.
Now, you guys partner with organizations in the community too, because I mean that's how we met, is
that's
through
the
branches.
Exactly.
Now, what type of organizations do you normally, partner with?
So there's a lot of different. So Beacon will work with a lot of variety of different places, like hospitals, assisted livings, nursing homes. So in partnering in the community, a lot of times the assisted livings, that's how we met at the branches in November when we did the Veteran Day pinning for them,
Right.
where we pinned all of the veterans that were residents there, and then some North Attleboro local veterans came in and were pinned also.
Right.
So we tried to make sure that in the community we're able to identify like the different veteran community groups and who we can partner with. So there are a lot of different places that we'll partner, but assisted livings are big because they like to have a lot of different agencies come in and offer different activities and different things that we can help them with.
To help educate the folks and
Yep,
stuff like that.
exactly.
And it's good that you're involved with the Providence and Brockton VA and partnering with them, because there are benefits such as the aid and attendance, in which folks may or may not know that they're eligible for. And I think having a partnership between yourself and myself is great, because we can do a lot of good on getting these people benefits that they're entitled to.
Exactly.
Now, we're all on social media. I know you guys are too. So what type of social media are you guys on, and how do people get in contact with you?
Yeah, so Amedisys is our parent company. It's spelled AMEDISYS. They have a Facebook page, so you could follow us, and they'll often have links about hospice and blogs about what we're doing out there. We're also on LinkedIn. If you follow either myself or Lisa, anything that we're doing that's different or special, we'll put up there as well. But I would say our local offices are probably the best way to get someone to come out to you, because we do cover the whole state, and we're in Rhode Island and New Hampshire and Maine and Connecticut. Really, wherever you are, we'll come meet you. We can give the Fall River.
Yeah, what's the Fall
office.
River phone number?
It's 508-324-1900. So if anyone has any questions either about the services we provide or volunteering, or would like to set up just an informational to have us come out and talk to them and see what's going on with their loved one, that's where they will find us.
Now, is there anything that else you wanted to share before we close out the show?
I think just obviously thank you for this opportunity, for letting us kind of get out here and talk, because the hardest thing for us to accept on a daily basis is just the myth behind what we actually do every day, and what the benefit truly is. So this is a benefit that is just going to support you through your prognosis, not going to do anything but let us bring in some quality, some dignity, some end of life goals. If you have Medicare, it's 100% covered by Medicare. It also picks up any prescriptions that are related to your diagnosis, any durable medical equipment that's related to your diagnosis. So there's a lot to know about it, and how it would directly help you or your family member. So don't be afraid to reach out to us and ask us more about it. It doesn't mean that, like I said, that you're dying today.
Right.
It means that we're here to support you, and it is a tough thing to accept, but we're here to help you get through that.
All right, thank you.
And I second what Kelly said. Just education and knowledge is power. So the more that the families know what hospice really is and what they're eligible for, it's good to just have that information.
There's also a quiz if you're online and you go to Google and you just search what is hospice. There's a quiz that it will say, is hospice the answer, from our organization? And it has just some check boxes for you. So it could maybe help you understand if maybe this benefit is right for you at the time. So what we do is once you fill that out, it will come to us, and we'll generally get back to you within 30 minutes if you reach out to us and see.
Oh,
if
wow,
you
30
need-
minutes.
Yeah, it's quick. And when we have live referrals from doctors or facilities, where our response time is hopefully responding to the referral within 1 hour and admitting within 4, same day. So that's our commitment, because oftentimes, like we said in the beginning, about 43% of the people that need hospice are actually getting hospice. So we've got a lot of work to do with that. And the median length of stay is around 17 days. So a 6-month benefit, and we're only able to bring, 17 days. We got a lot of work to do to be able to bring this benefit to our folks longer.
Absolutely. Well, thank you, ladies, very much for joining us today, and I
Thank you.
appreciate all your information, and I look forward to partnering with you in the future.
Definitely.
Thank you very much.
Thank you so much for joining us on Veterans Forum, and until next time, we will talk about another organization in our community, and that's a great resource for you. Thank you. Have a good night.